How do you know if you have scoliosis? The only way to definitely know whether or not you have scoliosis is to be assessed and diagnosed by a medical professional. In order to reach that diagnosis of scoliosis, there are parameters that have to be met. And the development of an unnatural sideways curvature where the spine also rotates into the concavity of the scoliosis, and the curve has to be a minimum of 10 degrees or greater in order for it to be considered a scoliosis. Now, a Cobb angle is the gold standard in measuring a scoliosis, and this assessment is typically done on a scoliosis x-ray. And it's normally measured by drawing lines from the topmost tilted vertebra to the bottommost tilted vertebra and comparing the tilts in degrees. And these degrees tell you how large or how severe the scoliosis is. The higher the angle or the bigger the number, the more severe the scoliosis is. When it comes to measuring or determining the severity, scoliosis can range from mild to moderate to severe to very severe. Mild scoliosis is where the Cobb angle measures between 10 and 25 degrees. Once we break 25 degrees but less than 40 degrees, this is where we call this moderate scoliosis. When the scoliosis gets greater than 40 degrees, this is where we call it severe. And anything greater than 80 degrees is a term I like to use, very severe scoliosis. Now, one thing I want to understand about these categories of severity, these categories of severity are related to surgical intervention. So when they're saying a curve is mild, they're saying it's too small to do surgery. It's not necessarily saying that it's not going to be a problem or not cause pain in the future or not lead to cosmetic problems or postural problems. What they're saying is right now the curve is too small to consider surgery. The same thing with moderate. They say moderate is too small to consider surgery. It's only when they hit the severe categories, now they say this curve is now considered a surgical treatment option. So these categories can be deceiving to patients because sometimes if they hear the word mild, they think, oh, not to worry about it. But remember, all severe scoliosis was once mild because it progresses into this more severe stage over time. Now, some early signs of scoliosis for parents to watch for in children, when we look at this being the most common type of scoliosis that's associated. When people think of scoliosis, they think of kids with scoliosis, and the most common type is something called adolescent idiopathic scoliosis, which is typically diagnosed between 10 and 18 years of age. Now, understand that every adolescent that had scoliosis probably had scoliosis in juvenile age. They just wasn't big enough for them to see it, meaning as curves are small, 5, 10, 15 degrees, they're sometimes very, very difficult to see because the only outward effect most of the time is posture, an asymmetrical posture, asymmetrical waist, asymmetrical ribs, asymmetrical shoulder heights, some kind of asymmetry in looking at the body. And since there's this asymmetrical posture pattern and no pain or symptoms associated with, many kids are not treated or even looked at because they think this posture problem is so little, so small, nobody takes these things seriously. There is never a normal presentation for asymmetrical posture in a child. If you see asymmetry in your child's posture, you want to have that evaluated because remember, all small curves can become more severe over time. Now, when we look at what are some early signs of scoliosis in an adult phase, typically the first sign tends to be if we're not seeing a postural misalignment, because it can also be that. It can be a kind of postural misalignment like we see in adolescence, but the most common reason why adults are diagnosed is because they feel pain. And because what ends up happening is as scoliosis moves into the adult form, it no longer progresses because of growth. Now it's progressing because of gravity compressing the spine down, and this compression causes slow progression over time. And this progression, because it's compressive, tends to become painful. And this compression of the unevenly around the muscles, tissues, and discs and areas around the spine affect adults with pain. Now, scoliosis pain can include like back pain, neck pain, pain that radiates into the leg, into the low back, and it sometimes radiates into the legs. Now, unfortunately, when patients experience pain, they typically go to doctors and they'll take x-rays and they'll say, well, they don't see anything, even though the patient may have a scoliosis. And a lot of times scoliosis could be not even brought up in the conversation because, like I mentioned, if curves are in the mild or moderate stage, there's nothing for orthopedic doctors to do with the scoliosis. It gets into the severe range. So many times the scoliosis can be completely discounted. So if you're having any kind of back pain or spinal pain and you get an x-ray or image done, I definitely recommend that you look at the image image yourself. Because if you see any kind of curvature, you have a scoliosis. And even though the doctor's not talking about it to you because there's nothing they can do until it becomes severe, it doesn't mean it's not related to your symptoms and what you're feeling. So if we see a scoliosis, remember, curves become painful in the adult form, even small curves, because the progression is a result of compression over time. And pain is by far the first symptom that brings on the diagnosis. Now, we look at scoliosis treatment. We normally break down treatments into two different types of main approaches. Traditional scoliosis treatment tends to focus on waiting for curves to become severe enough to do surgery. Now, what I mean by traditional treatment, I mean treatment that's typically managed by orthopedic surgeons. Normally, there's very little treatments offered for anything less than a surgical level curve. Mild curves, they normally don't recommend anything. Once curves are moderate, they may recommend treatment if the patient's actively going through rapid growth. But outside of that, there's no treatment, no therapy, no rehab, nothing to try to reduce the curve to prevent it from becoming a surgical level curve. However, modern conservative treatment normally offers proactive approaches to try to reduce curves before they progress into surgical standards to help mitigate the problems associated with scoliosis progression in the adolescent or in the adult stage. So if you're looking at scoliosis treatment, conservative chiropractic-centered approaches offer much more wide variety of treatment options for many patients with mild, moderate, or even severe scoliosis. By combining condition-specific chiropractic care, physical therapy, corrective bracing, rehabilitations can all be combined in a very specific way to impact scoliosis on a structural level. And the way we want to impact scoliosis on a structural level is it's going to help patients function better for a longer period of their life without having their scoliosis affect them in a negative way and causing disabilities and pain and malfunction, which can be completely avoided if the scoliosis is treated early. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.